were talking before we actually went live about the fact that you've got 3 different kinds of economic models.
Yeah.
And that one could argue that as other countries come to the conclusion that only that single payer system is really able to remove the fragmentation and to create an economic model that really allows driving costs down and creating value. Well, at least you said that earlier.
Yes,
We discussed that earlier.
Yeah.
So if Ted's right, and that is the underlying initiative here,
Yeah.
is that a bad thing?
Let's say my answer to the question is going to be consolidation to what end. So, and I think motive is very important. So, in a lot of cases, consolidation is not necessarily a mechanism for reducing costs. It usually ends up in increasing price. So we've seen that as airlines consolidate. Usually consolidation leads to economies of scale for the business, but it doesn't necessarily translate into cheaper prices for the consumer or the patient. But the healthcare, so that's kind of the cynical view perhaps of consolidation, but the healthcare marketplace is what we were talking about before, and I'm going to take my organizational hat off and put my sort of political economist hat on.
See, everybody's got hats.
Yeah. Part of the schizophrenia of the system that we have is it doesn't have a solid, it's not built on any solid rock of any particular sort of any market, whether it's government controlled, whether it's regulated utility, or whether it is more free market or mixed economy. And so we've got this hodgepodge of different things, and it's chaos.
Right.
So, and this is sometimes you have solutions that are more market oriented. Sometimes you have solutions that are more command and control. And sometimes you have solutions that don't really make sense, in any particular way. They're kind of like left to interpretation, like the way you've interpreted Part B potentially. So I think that's one of our big problems is you sort of have to pick a place and say we're trying to design, we want this to be the fundamental economic bedrock of this sector. And until we decide that, I think we're just gonna continue to have this chaos. Now, put that little esoteric thing aside, or didactic, soapbox aside. From a patient perspective, I think there could be some benefit, depending on the consolidation to what end. So if it's consolidation to accommodate, payment reform, that actually could drive, could drive costs down, or at least create a better environment for delivering quality and value as opposed to fee for service. And you do get a better care coordination model potentially, and all the the benefits and the upsides potentially to consolidation. If that's the purpose, then in some ways it could be better for patients. Oftentimes, though, when these things happen, they don't end up. Just seems to be continually patients in every case are losing, particularly the low-income patients. None of these conversations really resonate down to that level of anything that's going to bring reform or change to them, because we're not talking about how do we change value and delivery of service to that patient population that is the most ill and the most in need. So a lot of this is kind of lost in translation for them. But so I don't have a good answer. I think we welcome payment reform. We welcome this conversation about value because it does open the door to rethinking healthcare system payment and delivery, and how do we align incentives against what we're trying to achieve ultimately in the in terms of what we're trying to deliver. But I don't think we've determined yet what is it that we're trying to deliver. What is the goal of healthcare? What are we trying to achieve with healthcare? And until we have that answer, you don't have a central organizing principle around which to organize delivery, payment, et cetera.
I'll just say, to figuring that all out very briefly, you do need all stakeholders at the table. And when you talk about backdooring an agenda, if you don't have providers at the table when you're developing a new way of paying providers, or you don't have patient advocacy at the table when you think about patient care being the central component of what you're actually trying to deliver on, I think there's reasons that there's some backlash around the CMS experiment right now.